The National Blood Transfusion Service is reporting a 35% decline in blood donations from March to October 2020 and an overall 22% reduction for the year, resulting in the depletion in blood supply for critically ill patients. On an average, 10,000 to 12,000 units of blood are donated on an annual basis. Director of the Blood Bank, Dr. Pedro Lewis, in an exclusive interview with Nightly News, recently ascribed the decline in blood donations to the populace being worried on the heels of the confirmation of the presence of the unprecedented disease locally.
We didn't feel it that much, the impact, because of course most of the hospital postponed the elective surgery, like open heart surgeries and so on, that we usually have like 3-4 times a year. That wasn't in 2020.
He said, however, due to the COVID-19 restrictions, the transfusion service was forced to come up with innovative ways of reaching more donors. Ways that included tele-recruiting as well as extensive sensitization campaigns in the various administrative regions. As a result of these innovative initiatives, blood collection began to see an increase in the beginning of November. Dr. Pedro reminded that blood is in constant demand for accident victims, surgery and cancer patients. And more importantly, he's optimistic that this year's donations will exceed 2020's, since some medical institutions are likely to resume elective surgeries later this year.
I'm hoping this year that we could reach a very good number. What is important is that majority of those numbers, 98 to 100%, should be voluntary donors. I always say that family blood donation, we don't promote it much, but we don't turn back relatives if they want to donate.
The blood bank has collection sites in regions 2, 3, and 4, as well as ongoing blood drives in regions 6, 9, and 10. A significant percentage of the blood collected by the National Blood Transfusion Service comes from blood drives. Temika Rodney reporting for the HGP Nightly News.